All right, let's get into our top story, which is, of course, U.S. sovereignty being handed over to the World Health Organization. And this happens in about 4 days, right? February 27th.
Right. So over the next few days, the World Health Organization and member states are going to work out the details of this intergovernmental negotiating body meeting that happens on February 27th. And what they're trying to do is hand over power to the World Health Organization to dictate policies for future pandemics. The Biden administration last fall released a statement with the WHO saying, we see the need for this. We like it. We think it's important. We're going to do this. We're all in. This is called the WHO CA+, so that's how I'm going to refer to it. All 194 WHO member states are going to allow the WHO the power to declare and manage global pandemic emergencies. That means they could mandate lockdowns. They could mandate vaccines. They could dictate vaccine supplies and distribution. And they can monitor and put in place surveillance of entire populations. I'm going to show you the language because I went through the CA Plus today that hands this to them. Here is what the draft of this treaty, because it's only in draft form right now. Here's what it says. Here's the vision, is that it aims for a world where pandemics are effectively controlled to protect present and future generations from pandemics and their devastating consequences, and to advance the enjoyment of the highest attainable standard of health for all peoples based on the basis of equity, human rights, and solidarity, with a view to achieving universal health coverage while recognizing the sovereign rights of countries, acknowledging the difference in levels of development among countries respecting their national context, and recognizing relevant international instruments. So, okay, that sounds kind of nice, but it's predicated on the idea.
Wait, what part sounds nice?
I mean, the idea of like we all get equal access to medicines that we need.
So like, okay, sub-Saharan Africa that gets screwed, and wealthy countries get the medications, or they charge insane prices, or that sort of.
Well, we saw this
right.
happen during the monkeypox outbreak, because Africa has been suffering from monkeypox for decades now, and did not have access to vaccines. But as soon as Western countries have it, hey, here's some vaccines we can use. We've had it in our stockpiles.
And the WHO really already had that power during this last pandemic, because they were the ones censoring. If you had any kind of notice on the bottom of your video, it was going by WHO guidelines. And so they were demonizing drugs already that were alternatives to what's on the market. So it's already happening. They're just going to make it more official now, it sounds.
Right. Yeah, right. They would shoot down things that were more natural curatives, et cetera, in favor of biopharmaceuticals that would make billions of dollars.
Yes. And the idea.
Not to mention.
Oh, go ahead.
Sorry. Not to mention that like if they go with the whole international lockdown routine again, how does that work for distributing then across borders? If it's all then going to be global, are they going to just have to build like in all 194 states, like the manufacturing for any kind of medication or anything that they would need? Because you can't lock down the borders and restrict international travel and then freely distribute what's needed to 194 countries. It seems like
they do address that, but it's not. It's light on the biopharmaceutical collaboration, because they say, we're going to talk about it in a bit, but it's like they encourage pharmaceuticals to work together and share technology so that each member state could make their own vaccines. But it's very loosely enforced in this language, unlike the surveillance language, which is not quite so loose. That's a really good question. Also, I just want to touch on the fact that the World Health Organization is saying, well, some countries did good and some countries didn't. And we don't have data to support this, that anybody sort of followed the WHO to a point and did better than anybody else. I think right now, disagree with me if you'd like, right now, it sort of feels like everyone came out of the pandemic the same, whether there was strict or not strict lockdowns. Like no one country was able to like do better through government policy.
In what way, though? I mean, in what way?
Outcomes of the pandemic. Like it does feel like.
Well, we don't know yet fully, right? And I guess we won't know for a few years. But like kids not being locked down at home and education being damaged, where they're set back a year or 2 years.
But I'm talking about just like getting through it, because we're now seeing that a lot of the deaths that we were told were COVID deaths were deaths with COVID. Fewer are being attributed to COVID. It seems like no actual government policy got one country through it better than another.
I think Switzerland did, or whatever, because if you're saying they didn't listen to government, U.S. government policy versus their own, because they didn't do all the things we did here, and they got through it much better than we did.
Yes.
And I believe that was government.
Yes.
Yeah, let us know in the chat what you guys think. Let us know. Did any one country come out of this smelling like total roses? I mean, we use Sweden as an example, and some people say, like Brazil's still going through that. Well, they're still going through it for mandates issues and other things, of course. And now China, that would fully lock down the no COVID policy. Then suddenly everyone got COVID last week or over the past few weeks. Like everyone got it, right? So that was not the solution. That was the awful solution.
And so the WHO is making the point that because everyone handled it differently, we need to make sure everyone handles it the same, even though it would seem to me that the data plays out that everyone handled it this differently and then ended up sort of like getting through it with a similar outcome. Like we all just had to survive it, just get through it, I guess. Is maybe survive is the wrong choice of words. But anyway, I don't think I can agree with the premise that the WHO, had all the right policies, and it's just that we had a bunch of countries acting as bad children who didn't.
Like we and we should really point out who funds the World Health Organization, right? At the heart of this, the number one funder of the World Health Organization is the Bill and Melinda Gates Foundation. Number one, as Whitney Webb on our show has articulately laid out, right? So the amount of money that comes from a group that is intimately tied to the biopharmaceutical complex, making money off of this, and then has written books and laid out plans about how the next pandemic will unfold, is behind the World Health Organization. Right? At the heart of all of this.
Yeah. And I think the point I think history will eventually show that the countries with the fewest WHO related restrictions are the ones that may have done the best. That does seem, and so what they're saying here is we need more universal policy, when it doesn't seem that policy actually got anyone through the pandemic, is the point that I'm trying to make.
Right. Yeah.
And so, okay, that's something we can debate.
Yeah.
But again, I don't think that the WHO really has a strong leg to stand on right now, because the things that they were saying ended up not being all that reliable as we went, when we rewind the tape.
Right. So let me just say now, to put a tighter point on that, we are now ceding control of our response to a next round of any kind of pandemic, to an organization that doesn't have a good track record from the last one, and who is not elected, is an unelected group of people that we are ceding power to. Like, I just want to really drive home this point, because I don't think people are understanding this. And certainly when they see this is not being covered, I did a search, this is not being covered in the mainstream media at all in this way. And it's almost being played up by like the Atlantic and other news organizations I was reading today as a really good thing. Like, this is a really good thing that we're ceding our power to the World Health Organization. Right. I'm going to go through the CA+. And I'm just going to give you the worst case scenario of the things that the WHO is giving themselves power with this document. And I made a list as I went through it. One, they want to give themselves power to define the next pandemic. So what is it? What's the sickness? What's the lockdown? Or, what is it that we're running from? To determine lockdowns, give themselves surveillance power, determine treatments, vaccine mandates, vaccine distribution, vaccine IP and profits, and redistribution of pretty much everything. I'm going to show you. There's a sort of part in here that I'm like, whoa! Like, they think they can literally change use of land because of pandemic prevention. This is again the eminent domain clause that we've been talking about. We've covered this over the past few months, and this was one of the biggest things that stood out. Most people weren't covering this, is that they have the right to seize land. They have the right to seize property.
And we're going to show you the language that they give themselves this power. So because this is a draft, the WHO hasn't even defined certain powers or problems. See this working document? This is like, you know, they were able to define what a pandemic is and what populations are, but these things are like holding pattern. Okay, pathogen with pandemic potential means they don't even know what that means yet, what it means to have a potential. These things I do not like. The things in red are the things that give me stomach ache. For instance, the World One Health surveillance means they don't know yet, but they're going to get to it, meaning everybody surveyed, but we'll define that later. Interpandemic, I don't know what that is, like a pandemic within a pandemic. It's a meta pandemic. Finally, the one I like the least here is infodemic. Like, okay, we know how the
disinformation attack on,
Yes, right? So they do know how they define a pandemic. Here's the definition of pandemic. It's like a pathogen that infects human populations. But information, an info pandemic, is an idea linked to severe morbidity and high mortality, maybe? So will they want to link thoughts and ideas and speech to human mortality and control that too? You can imagine. I hate that. Yeah. And every solution.
Every solution is an inoculation.
Right.
Whether it's inoculation of information, an inoculation of a vaccine.
Yes.
Yeah.
And you know, there's long history in this too. I'm just, reading a book right now just on a subset of Nazi Germany, and this was exactly part of it. Understanding and controlling every drop of information along the way, and they absolutely knew that the slightest crack in that could lead to all sorts of problems for them. So yes, absolutely controlling the narrative.
Yeah. This document
this is
does.
Something that,
yeah.
Oh, sorry. This is something that I kind of agree, and maybe this is not the right time in the conversation to have this, but I kind of agree with something that Elon Musk had said recently with the danger of this, and I can see that the danger of this. Whereas if you have 194 governments running their if we're in a global pandemic and they're each running their own thing, and a couple of those governments fail at what they're trying to do, the majority of them still survive. If you have one shot and you don't have any overage. So if they screw up the rollout of their pandemic plans, that's global.
Yeah.
They screw it up for everybody.
Right. And then
it turns something which could be contained into like a extinction event.
Right. And then
I don't like that word.
Well, and then what are the consequences for this unelected group of globalists? Where is there like a high court that can try them?
Well, they do talk about how if two nation states have a dispute, how they work out that litigation and what domain. And they talk about these elected bodies. There must be like 2 presidents from each country that are serving on the board, and that there will be a auditor at the end of every, but none of them are elected by us. They're only internally elected by WHO and member states. So let's get back to the document and the things that should be, concerning us. It does say that states maintain sovereignty for pandemic preparedness, but not during actual pandemics. It also says that states that join this are bound by their obligations to this document. Take a look here, which defers a central role to the WHO. Basically, it's our way or the highway. Now, it does not discourage private companies from profiting from a vaccine a la Pfizer, Moderna, but it does say that they should share technology, so they're not the only ones who know how to make a vaccine that gets us out of the pandemic. But it's very loose on that language, which makes me think that biopharmaceuticals are like, well, yeah, we'll pay lip service to that, but we're not actually going to do it when it comes time to profit from vaccines. It's very heavy with the word encourage. Take a look here. Like, they will encourage patent holders to, waive their royalties or share their patents. We encourage this.
Right.
We encourage big pharma to coordinate, but they don't have to. According to this document, they absolutely still are free to profit. So when and if that happens, it's okay. We sort of got around it with this fast and loose language.
Well, we saw this in the last pandemic, right? So we have a track record, we have a history here. These companies are not going to do that.
No.
They're absolutely going to not, even being encouraged to share is still not going to happen.
Now, it does address strengthening healthcare workforce to make sure that they could handle another pandemic, but they're very interested in gender disparity because they point out that women were disproportionately emergency workers and healthcare workers, and they're worried that the workforce we had before was not diverse enough. So as we're preparing for the next pandemic, we're really interested in representation. And it like representation of healthcare workers, that it shows a diverse. Like, is this a problem during a pandemic that like, oh, I just wish I saw more diverse healthcare workers working on me?
No, this is, of course, the priority of the left, right? This is absolutely the priority of the Biden administration, which is this, like, instead of fixing the country, we're more concerned about equity.
Right.
Like, we're more concerned about making sure that we have a cabinet that has a multiplicity of different genders and gender.
Women disproportionately self-select into nursing. Right. Is that a problem?
Right. Biologically, we know that women gravitate towards, as Jordan Peterson talks about, like women gravitate towards emotional and to people. Right? Men gravitate towards things. That's why there's more men in engineering and women in nursing. It's just biology, right? And so now we should write this into the World Health Organization rules that we can't have women being nurses, but you need equity during a pandemic.
I don't know
we
exactly
need more men
what that's
ridiculous.
About. Go ahead, David.
Well, and I was just going to point out, like, we've already seen what can happen with this. There was a woman who had a traumatic experience with a man, and she did not want a biological man working on her in the hospital, and they put a trans nurse with her, and she did not like that. So they made her leave the hospital, the patient.
Yeah.
So that's where this can go.
Yes.
And it will.
Yeah. And so we need more, but I don't know, a trans woman does not want to represent male enrollment in the nursing industry. They want to represent female enrollment, so that's confusing. I'm just not clear where the problem is here. I mean, I do understand that women were disproportionately affected as first-line workers, but they had self-selected into this industry. I don't think that in itself is a problem. So, you know, I'm free to, I open myself up to being challenged about this. Okay, now about misinformation and infodemics, a new word that I just hate. I hate it, infodemics, but we know it now. We can at least look out for it and reject it. The World Health Organization says they want to conduct social listening campaigns. Could that be another word for surveillance?
Yes.
They want to figure out what your health literacy is. They want to make sure you have better health literacy. That's what they call it. And then they will do so by tackling false, misleading, misinformation, and disinformation, including through promotion of international cooperation. And so, you know, they're going to just try and teach you to be a better consumer of health news, raise your IQ about medicine, if you will. And then again, this regular social listening and analysis, could that be code for surveillance?
Yes.
In which case, everything becomes surveillance. Because right now, our Constitution protects us. Although, as Edward Snowden points out, you know, the government gives itself powers to collect information that they think is necessary based on certain reinterpretation of laws or certain power grabs or what have you. So this could supersede the U.S. right to privacy if we think, I need to know how you think at all times in case you are capable of launching an infodemic that causes other people to say, take this thing or feel this way, or like, what if you said that you were super into nude yoga is the way to survive the next pandemic, and that's so dangerous that then, you know, they need to, I mean, you can see how that's the stupidest example I could think of, because it's relevant.
I think nude yoga is a curative. So
it may very well be, or you could break an arm, because that sounds slippery.
That's what they were doing at Epstein Island. So the problem I have is not just that they're surveilling, is that this is outside, and this is outside of the U.S. government court system. Like this is now ceding control to an organization that will, I mean, if someone does share this information and they are feeling like their rights are infringed, where do they go? Because it's not going to be upheld in the courts. It's not going to be upheld in the United States court system.
Right.
Who are you filing this against?
Yeah.
You've literally ceded control, and now we're in a, quote, emergency situation. According to whom? Well, according to the WHO that we've now ceded our power to. So the U.S. Supreme Court here, and this is the point that Catherine Austin Fitts makes about this, is that now the U.S. court system is out of the picture.
Yes.
Right? So you don't have any power. And the point of this is, and this is again why Africa stood up to this when they were voting on this at the end of the summer and these draft proposals, and Africa said no way, and the world stood up and applauded African countries for putting their foot down, because they saw that they didn't want to be ceding any more control to these Western elites. And that's really what it is. It's almost like colonialists in a way, right? So they're ceding this power to these Western elites once again, giving away their sovereignty. And they said, in African countries said, we don't want to do that anymore. With hundreds of years of you doing this to us, we're not doing it anymore.
Because if an infodemic is at stake, then all wrongthink becomes a reason to survey, a reason to deplatform, a reason to what?
Right.
Right?
We've already
accuse you of a crime for wrongthink?
Well, we've already, and David brought it up earlier, like, we've been deplatformed on YouTube multiple times, 4 times to be exact, banned and blocked for things that we were literally, that was coming out from science, from doctors, the medical professionals, and not only that, reading from Pfizer's own classified documents that ended up coming out. And yet, because the WHO, the World Health Organization, had certain guidelines in place, YouTube ceded its own power to the WHO. And therefore, in their own terms of service, Google's own terms of service, they would ban you and block you based on what the WHO said. So they were already ceding power, and then they can basically defer to it and say, no, we go with what the WHO says.
Yeah.
Well, and beyond that, we saw it happen on... Oh, sorry, Philip.
That's okay. Go ahead.
We saw even the newsletter. So in your email, our newsletter has been called dangerous. So it's like the platforms, your email, this is expanding everywhere.
Yes. Yeah.
Yeah. Go ahead, Philip.
Yeah. So in that though, like that last image we had up there, we're talking about like the social listening and the increasing your health, like the public health literacy. Like I see that very much as all of these countries signing on to give up science to just one, like basically what the WHO wants.
Yeah.
So I would see this as it's not just them like saying what information is or is not out there, but actually preventing people from studying things they don't want. And if we relinquish control over science and scientific data gathering, then they can basically just feed us anything they want, and we have no alternative. We have nothing to say about it.
Yeah.
Just giving them control of the science.
Yes, you're right. Now, I just today finished Edward Snowden's autobiography, and he talks about how, based on his disclosures, there were many court cases that did remove the right to survey from the NSA and other CI documents. Other agencies, rather. And he felt like it handed it over to the court system, and the court system got a lot of it right, and so that it was worth it. But we would not have this right to take it to whatever international court. According to this document, if we were being surveyed, if we were being silenced, if we were being accused of spreading infodemics, I really don't know what our recourse would be. Now, about this redistribution of everything concern, here's where I got that. Again, this is from the CA+. This clause says that the parties in CA+ will identify and integrate into relevant pandemic prevention and preparedness plans interventions that address the drivers of the emergence and reemergence of disease at the human-animal environment interface, including but not limited to climate change, land use change, wildlife trade, desertification, and antimicrobial resistance. So, land use change is a concerning, like, they can decide.
Animal environment interface. I mean, this is exactly what's been happening in the Netherlands.
So they can say, like, for instance, bats can't find enough water to drink because of drought, because of climate change.
Right.
And so then they're bringing viruses into human populations. And so we need to change completely the way we farm or what have you.
Right. Or because of nitrogen levels, we want to make sure that people are kept inside of a city in 15-minute cities. We don't want people driving because of the concerns about expansion of this virus in some capacity. We want to keep you here in this place, locked down. We don't want you driving anywhere. We're taking your farms away. This is exactly what's been happening. It's been happening in New Zealand. It's been happening in the United States. It's been happening in the Netherlands. It's been happening around the world. So this is not
only going to truck in approved food.
Yeah, I mean, this is not a conspiracy theorist, and I see a lot of conspiracy theory. I see a lot of people in the chat saying, "Guys, wake up! This is not a conspiracy theory." And people in the chat are saying this. This is happening right now. 4 days they vote on this.
Oh, yeah. I mean, a lot of it I have sort of, like, oh, that can't be. No, that's probably not the case. And then I read this document and I'm like, WTF, it's real. This is real. What they actually are writing out.
It's in the document. These guys got together. Oh, come on.
And when everybody signs in on that, when everybody signs off on this gives them what they have wanted basically forever. It gives the power on a global scale to a few elite people, like we like to say, unelected people. It gives them the power to seize land, to force whatever change they want. They can do it all under the guise of this WHO document. They're like, "Look, everybody signed on this, so we can seize your land. We can call herds. We can basically prevent people from hunting, prevent people from growing their own food, prevent people from collecting their own rainwater, all down the list." And so that everything is now mandated that it has to come from this handful of people who are unelected, who now seize control of everything. They've just been waiting.
And one thing you didn't even mention, Philip, was the money supply. And this is why they don't want you to have cash. Right. They want you to move away from, they don't want you to have gold. They don't want you to have silver. They don't want you to have cash. They want you to move towards a digital currency that they control everything, which is all fake. It's artificial to begin with. They don't want you to go into bank tellers. Banks now reward you for staying home and staying away from the bank, right? You get extra. You think you save money on your checking account if you do not go to the bank, right? They don't want you to be involved in your own money. They want a digital supply.
I mean, but you talk about land use, right? Or right to access land. Think about vaccine mandates, right? So many people were able to get exemptions for their vaccine mandates or what have you. You won't have that option. They're just going to come to you, stick you with something.
Yeah.
And, or else you don't access any land except maybe your own bedroom or what have you.
And money. Right. Oh, we have your vaccine passport. You didn't get your vaccine, your WHO approved vaccine. Therefore, we're not giving you your money. We're not giving you your stipend. You don't have access to money.
Think about how far back they started the Real ID system, right? And I don't remember where I was, but I was at FedEx to ship a package. They grabbed my license and they scanned the back of my license at FedEx and got all my information. I was like, I didn't realize that was a thing, but now with this Real ID, it's going to be your passport will be tied to it. Your money is going to be tied to it. Yeah. All of this stuff is going to be tied to it. And all I can say is, I think we all owe Alex Jones an apology.
Yeah, who was absolutely right about it. And when they scanned your thing, they knew what you were sending. They knew what you were sending, scanning. Here's this, David sending packages here, this and that. They can control everything.
So the question remains, does Biden even have the power to do this? Recall that President Trump withdrew from the World Health Organization and President Biden signed us right back up as soon as he got into office. So could a future president then withdraw from the CA+? They could, but the CA+ is binding for 2 years at a time. But doesn't Biden need congressional approval to give this kind of power to an outside body? There is precedence that says that he could make an executive decision to sign us up for this.
Well, the executive branch, the executive branch is one of the few, let's be clear. The United States presidency, historically, under the Constitution, is pretty weak. It's a pretty weak office, actually. However, one area it's in strength is in treaties. Right? The executive branch and the president of the United States has the power of the treaty. And so this is seen as like a pandemic treaty, right? So this gives the president power. And this is the brilliance of this document, is that it falls under that umbrella.
Yeah.
And therefore, Congress be damned. And we also see that the expansion of the executive branch anyway over the past number of years, he can just go to war without Congress anyway. I mean, look what we're doing with, in Ukraine and every other war we're currently in, never got any congressional approval.
Now, you can see how a lot of these policies that are supposed to be handled at the state level would be challenging this, governors or attorneys general, but there's no guarantee that the Supreme Court takes up any of their cases. So it's, I mean, if I were a betting woman and I put the odds of the United States actually joining this treaty, I'm going to say 75%.
Yeah, I'm going to go with 100% because Biden's like, oh, it's all ready to go. So we're signing it on the 27th of February. We're ready to go. So
boys, do you want to ring in?
I'll say 100%.
Take your.
Yeah, no, I'm with you because it's like.
Go ahead, David.
Go ahead.
Yeah, that delay. So I think it's because we've seen what they do on war. They're always, against these little things on the fringes. But when it comes to things like this, they all jump in lockstep.
So you give me a number.
For that control.
A number.
I'm 100%. I'm with Clayton.
Okay. Philip?
I'd say, with David's point, that's exactly the point I was going to make. Like, this is one of those ideas where you have like a handful of people at the top making the decision for the majority of the people at the bottom, from their perspective. And we won't really have a say in it because we don't. So I would say that if you look at any country, I would imagine that around 70 to 75% probably of the people of that country would disagree with this decision, and it's just that upper echelon that's making the decision for them.
All right, I'm just holding out because I'm an optimist. I don't want to.
So you said 75%.
I say 75% chance it happens.
All right. Well,
that's still pretty significant.
Let us know in the chat what you guys think. What's your, on a range of 1 to 100, where do you guys think this is going to happen? Do you guys think this is going to happen? We'll even do a poll later about this. But let us know in the chat.
You see this contingency of people who are like gaming the world. Like, what part of the world can I live in where I feel like my kids aren't going to be conscripted into war and I won't have to have vaccine mandates and I'm not going to be beholden to this? And maybe now we'll see African passports start to gain favor and as the next passport that's like a passport of freedom. Who knows, right? The countries that are holdouts, where once maybe Brazil, now that president's gone, the president who is in office now likes the idea of this. So we'll see.
Yeah, and Bolsonaro said he's going back to Brazil to be the opposition, and Lula da Silva said, hey, we're going all back in on the WHO, so where you thought Brazil was holdout, not anymore. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.